Welcome back, friends. We have to gather all of our equipment for mixing and administering an IV medication through a secondary line. We've already got our IV started with a lock on it, which we just completed. We want to always gather all of your equipment. So we're going to gather 100 ml mini bag, a secondary administration set. So you can see right there, it says secondary medication set. And this one is a hanging and a free flow. So this one would not go in a pump. We need some sterile water to reconstitute our medication, which in this case we're going to use NaCl, a 10 ml syringe of NaCl. The medication to be administered, which in this case is penicillin G for GBS prophylaxis. We need a filler needle and a sharps container, which is right there. So we're going to introduce ourselves to this patient, this client. They've already consented to having interpartum prophylaxis. We're going to wash our hands, which we've already done when we've donned our gloves. So prior to any medication administration, you always want to do your medication rights. Make sure that you have the proper client, the proper medication, that we're using this medication for the proper indication, that you have the proper dose, the proper route, which in this case would be IV, the frequency. So if you're using penicillin G for group B strep prophylaxis, that would be 5 million units as a loading dose and 2.5 million units every 4 hours until the delivery of the baby. You want to make sure that you have the proper medication, the name that it says penicillin G on your package, that you have the proper strength. So again, we're using 5 million units. Make sure that it is not expired and that we reconstitute it properly. And you'll find that information on the bottle for reconstitution. The timing, so what time, the time that we're giving this to this patient, which typically is onset of active labor for a loading dose, the route, and that we have the correct supplies, which we do. We get consent, we wash our hands, we check our IV fluid, our running IV, making sure that it's running properly. Now we're going to draw up the correct volume of diluent for reconstitution of the penicillin, which on the bottle here, it says 3.1 mils to reconstitute this 5 million unit vial. We're going to use our $10 ml syringe of normal saline, as always, keeping the end sterile. We can move the air through and use our blunt fill needle to reconstitute our penicillin. Flipping the lid off. This top is sterile, so you always want to maintain your sterility again. I've probably said that 47 times by now, but it's very important. Remove the lid. Oops, the lid doesn't want to come off. There we go. And always sterile to sterile. So we're going to take 3 mils out of our NaCl and put it in our penicillin vial here. There we go. 3 mils. Perfect. Because our penicillin is in a powder form, we will need to reconstitute it. The best and easiest way to reconstitute powder is to roll it in your hands gently. Don't shake it, just roll it gently until it's reconstituted. Then we are going to take our syringe and we need a new filler needle as well. So for these purposes, we're using a non-filtered needle. So when we're withdrawing medications, we want to use a blunt fill needle, not a filter needle. So this is what you're looking for right here, a blunt fill needle. Attach it to the end of our sterile syringe, maintaining sterility again. And we're going to take our medication. There we go. And withdraw the proper amount. In this case, it's 3 mils. And insert it into our mini bag. We've cleaned this with alcohol before we insert the needle and the medication into the mini bag. I'm going to give it a couple of... Now we have our penicillin G ready to administer to our client here. Hang it on our IV bowl. And make sure that we have the proper giving set. Same as when we primed the line for the IV fluid, we will be priming the line for our medication administration. Now this one works by gravity, so you use your hook on your big bag to lower it. And then your mini bag hangs higher up. So again, just like we did before, we're going to make sure that we maintain sterility between our mini bag end and our giving set. Putting that clamp closed, and then we're filling it about halfway before we prime our line here. We open our line, prime it so that there's no air bubbles in the line. Close the roller clamp. And we are going to give this medication in the port that is the furthest away from our client. Right here. Prior to putting the line into the port, we always want to make sure that we clean our port. Make sure that our port is nice and clean. Like alcohol swab. Let it dry for 30 seconds. Take our lid off and put it directly into the port. Now once it's in the port, we can slowly open our roller clamp for our medication administration set to administer our IV antibiotics. We're going to adjust the rate visually by observing the drop rate in the chamber to approximately 100 mils per hour for this type of administration. We will be monitoring our patient for any adverse reactions. Of course, we'd make sure that this person is not allergic or doesn't have a known allergy to penicillin prior to this administration. And then we're going to document our procedure, what type of IV fluid we were using, the medication that we gave, the drip rate, and then make sure that the client is tolerating the procedure well. Once the medication administration is complete, then we would remove our medication administration set from the main IV line and discard the medication administration set with the medication, any medication remaining, into the proper disposal. One thing to make sure that you do when you're administering medication is to label your bag. Now, I was standing here the entire time, so it was never out of my sight, but it's always good practice to label your bag. You want to take your medication added to IV label, and we would write the patient's name, who it was added by, what the medication is, so 5 million units of penicillin G, and we would attach that to our mini bag so that we can see what the medication is. And then we're going to document our procedure.